Experiment number 1. Parenteral dosage form in clinical setting and equipment. During our experiments, you will use the following tools. This is called a surgical blade to open the cover of the vial. Beel to be opened here. This is the surgical blade. After you finish using the surgical blade, you should discard it inside a yellow container called sharp container. This is for the sharp and for the hazardous drug waste. You will use during the lab alcohol swabs to disinfect the rubber of IV bags and vials. This is called vial. Glass, made from a glass. The cover can be removed using the surgical blade. Ampules, you have two types of ampules, glass and plastic. The plastic can be opened by just twisting. This is an example of a sterile water for injection ampule. This is the glass one and can be opened by breaking the neck of the glass ampule. Now this is called an IV bag. This is another volume of IV bags. Syringes, we have different sizes. For example, this is insulin syringe, used subcutaneously and can be used to withdraw volume 1 ml and below. This is the 3 ml syringe, 5, 10 and 20. Let us take the 20 ml and looking at the syringe and the needle. This is the syringe part and this is the needle part. The needle, this is the cover of the needle. As you can see, this is called the point, and this is the lumen plus the point called bevel. This is the shaft, and the green color is called the hub. You should discard the needle inside the sharp container. This is the syringe, the tip of the syringe that is attached to the needle, to the hub of the needle. This is the barrel and the plunger. Plunger in, plunger out. This is called the flange of a plunger. Gloves with different sizes. For example, X small, medium, large, X large. You should use the suitable ones for you. And the last thing is the IV set. The IV set for the hospitalized patients to take, for example, normal saline, dextrose, antibiotic, and whatever. This is a sterile IV set, so that it should be opened inside an ultra clean area, which is the laminar flow hoods. Let us take a look for this IV set. This called the spike. The spike introduced inside the rubber of the IV bag. For example, this small IV bag, we will open it. This is the spike. And this is the drip chamber. The drip chamber, we can control the dripping, the number of drops using a clamp. This is the clamp, the control clamp. This is the control clamp to stop or to increase the drain. Tubes, these are the tubes, till we reach the catheter, needle-like. The catheter to be introduced to the hand of the patient. According to the gravity, we can control the drainage using the clamp. To stop now the drainage, to increase the drainage, as you can see. Thank you.